I guess the first thing to say is that this, in many ways, this building, as mentioned before, is a status building. It's rather grandiose. It's big. It's in your face, I suppose, and the transparency in here. I mean, you can look in, you can look out. So it's a very much a public space. I mean, even within the building itself, there are sort of more private spaces. There are sort of secure spaces, but even in the laboratories themselves, they're quite open plan. I mean, again, symbolically, this is shouting at you, we're interdisciplinary. I mean, one of the reasons for this building is to centralise resources, and psychogenetics is hooking its nose into a wide range of different practices, from brain imaging to genetics. I mean, contrast this building, this large building, with Attic, a very private space. Journeys itself, it isn't necessarily that visible from the street, and you access Attic through a side door and then go upstairs to the attic, as it were. So I think in terms of the buildings linking up, I think, you know, you've got the private space of the attic, you know, this kind of often locked space, hidden away space, often discarded space in most people's houses, and then you've got this large sort of transparent symbolic building. And I think it's about perhaps connecting those two buildings in some ways, getting across those sort of private matters, and then seeing how they could sort of transgress into this building, and in what ways can that be done, and vice versa as well, getting across sort of this sort of grand developments in psychiatric genetics, and then taking that back to individuals who might struggle with some of the disorders that the centre is working on. So I think buildings do certain things, they allow certain things, they enable certain things, and I think Attic is a comfortable space for lots of people, and a space where people can share certain subject matters that they wouldn't anywhere else. And I think that's one of the greatest achievements of Attic. Well, you wouldn't be discussing the certain subjects that really do affect certain individuals in a big, bold environment all the time. And this is where big isn't necessarily better, and actually quality and time and interest is more important than just large scale interaction, whereby you don't have that time to be able to discuss things, where I think Attic allows you to do that. Taboo is one of the reasons why things get stigmatized, and then they get kept within in-house, I suppose, and then not articulated, not talked about. That said, I think some people with mental health disorders, you know, it's extremely brave to be able to go out there and speak about things. And in these sort of large buildings, public spaces, they may not feel very comfortable in getting across certain things. They may find reactions prohibit them being able to talk about things that they'd like to talk about, but these spaces don't allow that. I think Attic does allow that, or allows it to a greater extent anyway. I think being able to share very personal, private, often taboo subject matters, I think these people are extremely brave, and I think the architecture of a space needs to be right to be able to do that.